Hello, my name is Anand Sridharani. I'm the Residency Program Director here for the University of Tennessee, Chattanooga Urology Department program. There's many things that make this program special. One of the biggest things I think is that a few of us have been part of the inception of the program. This is a new program, and so we've made this program from scratch. It's been around now 6 years, and we've done a great job at creating a program which our residents truly enjoy, feel like they get a great educational and surgical experience out of, and they have a lot of say in what goes on a day-to-day basis. So a lot of the residents can customize their educational experience as they go through the training program, which I think is really different and sets us apart from other training programs.
I'm David Thompson. I'm a second-year resident here in Chattanooga. Obviously, you definitely want to see all the cases, as many cases as you can, being a resident before you get out into the real world, and that how widespread Erlanger reaches out and draws patients in definitely allows you to have access to those different types of cases and makes you feel comfortable with kind of dealing with them on the floor and in the operating room.
One of the things that we've tried to highlight with our program is the diversity, and that's not just ethnic diversity, that's also diversity from training. Our faculty come from different programs and fellowship programs from the Northeast, Midwest, the South, and even the West. And that provides color for our training program. It's not just that everybody who has come through this training program is trained in the Tennessee area or within our program. A lot of our faculty come from different experiences, and that really makes our discussions about the management of urologic disease really, really awesome. And the residents really love this. There are multiple ways to deal with something, especially with routine urologic disease, and I think the faculty as a whole, since it is quite diverse, really emphasizes that, encourages that discussion, and I think that's just one of the best parts about our program.
So my name is Mandy Threlkeld. I'm the rising chief resident of the program, so this is the beginning of my 5th year. Some of the biggest strengths have always been our surgical volume here. We have an incredible catchment area regionally, and we also have a really great variety of cases, partially due to the many different providers that we have. So in addition to our several different robotic rooms, we have one of the nation's first single-site robotic platforms as well. Currently, that's only in use by the urology department, and it's sort of provided for us strictly for urologic cases. And that was actually the 7th one in the world, was brought to Erlanger. So that's a very nice perk to this program, is to be able to experience that and learn on such a new platform.
My name is Michael Tonzi. I'm the PGY3, so the Euro 2. I'm originally from Skaneateles, New York, in upstate New York. I completed medical school there at SUNY Upstate. I think one of the really great things about Chattanooga, especially if you're someone like myself who loves the outdoors and maybe even loves climbing, is that yes, your time in the hospital is going to be very demanding, and you're going to spend a lot of time, becoming a urologist. But the closer you are to those extracurricular hobbies and interests, the more grounded you're going to be. And I think that being in a place like Chattanooga, where all of that is literally a 10 or 15 minute drive from the hospital parking lot, I think that goes a long way. I think if you're in another big city or somewhere where it's going to take you an hour or 2 hours or a day to get out into the into nature, you're not going to have that accessibility like we do here. And I think for me personally, or for someone who's drawn to that as sort of a leveling aspect in your life, I think it's really valuable. Absolutely.
I love urology. I loved my training program, and when I came here, I want to bring that same love and enthusiasm to this training program. And I hope, and I really truly believe, that a lot of that love and effort that we've put into the training program shows. Our faculty, being as diverse as it is, also promotes the residents not to be one-dimensional. If they have interests in one area of urology, we'll support them to do that. If they changed interests, we're not going to necessarily look down on that at any given time. We're there to promote the education and the growth of the residents to what they see as important. What we feel is important is that they graduate with a good surgical training program, they respect the field, they respect their patients, and they go into the community or into academics, and they are doing exactly what they want to do, and to make the overall community for patients and for urologists better.